Question 1. The assessment process reveals that a patient presenting with fatigue and mild shortness of breath has a hemoglobin level that is slightly below the lower limit of the normal range, with other complete blood count parameters appearing within normal limits. The patient denies any history of bleeding or significant weight loss. Which of the following interpretations of this laboratory result is most appropriate for the registered clinical officer to consider initially? Option A. Recommending a repeat hemoglobin test in 3 months to monitor for any significant changes, given the mild nature of the abnormality and absence of other concerning symptoms. Option B. Ordering a battery of extensive investigations for malignancy or chronic disease without further clinical correlation due to the presence of any abnormal laboratory value. Option C. Immediately initiating iron supplementation therapy based solely on the slightly low hemoglobin level to address potential iron deficiency. Option D. Discussing the finding with the patient, considering it in conjunction with their presenting symptoms, medical history, and performing a focused physical examination to guide further investigation or management. The correct answer is A. Recommending a repeat hemoglobin test in 3 months to monitor for any significant changes, given the mild nature of the abnormality and absence of other concerning symptoms. Explanation. This scenario presents a professional challenge because interpreting laboratory results requires a nuanced understanding that goes beyond simple numerical values. A registered clinical officer, RCO, must integrate these results with the patient's clinical presentation, history, and other diagnostic information to form a comprehensive assessment. The challenge lies in avoiding premature conclusions, recognizing potential confounding factors, and understanding the limitations of laboratory tests. The correct approach represents best professional practice because it prioritizes a holistic patient assessment. By correlating laboratory findings with the patient's symptoms, medical history, and physical examination, the RCO ensures that the interpretation is clinically relevant and accurate. This aligns with the ethical duty of care to provide competent and individualized patient management. Furthermore, it adheres to the principles of evidence-based practice, where diagnostic decisions are informed by a synthesis of all available patient data. Regulatory frameworks for RCOs emphasize the importance of accurate diagnosis and appropriate management, which necessitates this integrated approach to laboratory result interpretation. An incorrect approach that focuses solely on a single abnormal laboratory value without considering the broader clinical picture is professionally unacceptable. This can lead to misdiagnosis, unnecessary investigations, or delayed appropriate treatment, violating the RCO's duty to act in the patient's best interest. Such an approach may also contraindicate regulatory requirements for comprehensive patient assessment and may fall short of the expected standard of care, potentially leading to professional misconduct. Another incorrect approach that relies on external, unverified interpretations or advice without critical clinical evaluation is also professionally unsound. This bypasses the RCO's professional judgment and responsibility, potentially exposing the patient to risks associated with unvalidated information. This failure to exercise independent professional judgment is a significant ethical and regulatory breach. The professional decision-making process for similar situations should involve a systematic approach. First, review the laboratory results in the context of the patient's presenting complaint and history. Second, consider the patient's physical examination findings. Third, evaluate the reliability and limitations of the laboratory tests performed. Fourth, consult relevant clinical guidelines or specialist advice if necessary, but always with critical clinical appraisal. And finally, integrate all information to formulate a diagnosis and management plan. This iterative process ensures that laboratory results are used as a tool within a broader clinical framework, rather than as definitive pronouncements. Question 2. Benchmark analysis indicates that when presented with 2 antihypertensive medications, one a beta blocker and the other a calcium channel blocker, a registered clinical officer, RCO, must accurately differentiate their pharmacological profiles. Which of the following approaches best reflects the required professional judgment and adherence to regulatory standards for drug classification and mechanism of action? Option A. Prioritize understanding the specific cellular targets and biochemical pathways affected by each drug to predict their distinct physiological responses and potential side effects. Option B. Focus on the shared therapeutic outcome of lowering blood pressure, assuming similar safety profiles due to the common goal. Option C. Classify the drugs based on whether they are administered orally or intravenously. Option D. Distinguish the medications primarily by their commercially recognized brand names. The correct answer is A. Prioritize understanding the specific cellular targets and biochemical pathways affected by each drug to predict their distinct physiological responses and potential side effects. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a registered clinical officer, RCO, to differentiate between two drug classes with similar therapeutic goals but distinct mechanisms of action and potential side effect profiles. Misidentification could lead to inappropriate prescribing, patient harm due to adverse drug reactions, or failure to achieve the desired therapeutic outcome. The RCO must possess a thorough understanding of pharmacology to make safe and effective clinical decisions, adhering to the principles of evidence-based practice and patient safety. Correct approach analysis. The correct approach involves accurately identifying the drug class based on its primary mechanism of action, which is the fundamental principle of pharmacotherapy. Understanding how a drug interacts with specific cellular targets or biochemical pathways is crucial for predicting its effects, potential interactions, and contraindications. This aligns with the RCO's professional responsibility to prescribe medications safely and effectively, ensuring patient well-being and adherence to professional standards of care, as outlined by the regulatory framework governing RCOs in this jurisdiction. Incorrect approaches analysis. Focusing solely on the therapeutic outcome without considering the mechanism of action is an incomplete and potentially dangerous approach. While both drugs might aim to lower blood pressure, their differing mechanisms mean they could have vastly different side effect profiles, contraindications, and interactions with other medications the patient may be taking. This oversight represents a failure to apply a comprehensive understanding of pharmacology, potentially leading to adverse drug events and contravening the duty of care. Classifying a drug based on its route of administration is irrelevant to its pharmacological action and therapeutic classification. The route of administration is a method of delivery, not an indicator of how the drug works within the body. This approach demonstrates a lack of fundamental pharmacological knowledge and a failure to grasp the core principles of drug action, which is a significant professional and ethical lapse. Confusing drugs based on their brand names rather than their generic names and pharmacological properties is a critical error. Brand names can vary, and multiple drugs may share a brand name for different indications. Relying on brand names without understanding the underlying active ingredient and its mechanism of action can lead to prescribing errors, duplicate therapy, or the administration of inappropriate medications. This reflects a superficial understanding and a failure to adhere to the rigorous standards expected of an RCO. Professional reasoning. When faced with differentiating between medications, an RCO should always prioritize understanding the drug's generic name, its primary mechanism of action, its therapeutic class, and its established safety profile. This involves consulting reliable pharmacological resources, understanding the patient's specific condition and comorbidities, and considering potential drug interactions. The decision-making process should be guided by evidence-based guidelines and the overarching principle of first, do no harm. Question 3. Consider a scenario where a clinical officer administering a new medication reports a near-miss event where the patient experienced a transient, mild adverse reaction that resolved spontaneously without intervention. The clinical officer is concerned about potential future harm and seeks guidance on the appropriate next steps. Which of the following approaches best aligns with risk management principles for clinical settings? Option A. Conduct a thorough impact assessment to understand the nature of the adverse reaction, its potential causes, contributing factors, and the likelihood and severity of future occurrences, followed by implementing appropriate preventative measures. Option B. Immediately escalate the incident for disciplinary review of the clinical officer involved to ensure accountability for the near miss. Option C. Focus solely on managing the immediate patient's condition and reassure them that the reaction was minor, without further investigation into the medication or administration process. Option D. Document the near miss in the patient's record and advise the clinical officer to be more vigilant in the future, but take no further organizational action as the reaction was mild and resolved. The correct answer is A. Conduct a thorough impact assessment to understand the nature of the adverse reaction, its potential causes, contributing factors, and the likelihood and severity of future occurrences, followed by implementing appropriate preventative measures. Explanation: this scenario presents a professional challenge due to the inherent conflict between immediate patient care needs and the systematic requirement for robust risk management. The RCO must balance the urgency of a potential adverse event with the need for a thorough, unbiased assessment to prevent future occurrences. This requires careful judgment to avoid both overreaction and complacency. The correct approach represents best professional practice because it aligns with the core principles of patient safety and quality improvement mandated by the regulatory framework for registered clinical officers. Specifically, it emphasizes a structured, evidence-based impact assessment that prioritizes patient well-being and organizational learning. This systematic process ensures that potential harms are identified, their severity and likelihood are evaluated, and appropriate mitigation strategies are developed and implemented. This adheres to the ethical duty of beneficence and non-maleficence, as well as the professional obligation to maintain and improve standards of care. An incorrect approach that focuses solely on immediate containment without a subsequent impact assessment fails to address the root causes of the potential adverse event. This represents a regulatory failure by neglecting the requirement for systematic incident reporting and analysis, which are crucial for identifying systemic weaknesses and preventing recurrence. Ethically, it falls short of the duty to learn from errors and improve patient safety. Another incorrect approach that involves immediate disciplinary action against the involved staff without a thorough investigation and impact assessment is premature and potentially unjust. This violates principles of fairness and due process, and it can create a climate of fear that discourages reporting of errors, thereby hindering the organization's ability to learn and improve. It also fails to address the systemic factors that may have contributed to the situation. A third incorrect approach that involves ignoring the incident due to perceived minor impact is a critical ethical and regulatory failure. It demonstrates a disregard for the potential for even minor incidents to escalate or indicate underlying systemic issues. This negligence can lead to a breakdown in patient safety culture and a failure to meet the regulatory obligation to proactively manage risks. The professional decision-making process for similar situations should involve a clear protocol for incident reporting and management. This protocol should guide the RCO to first ensure immediate patient safety, then initiate a structured impact assessment. This assessment should involve gathering all relevant information, analyzing the event's causes and potential consequences, and developing a plan for mitigation and prevention. Collaboration with relevant stakeholders, adherence to organizational policies, and continuous professional development in risk management are also essential components of sound professional judgment. Question 4. The investigation demonstrates a 45-year-old male presenting with a 2-week history of progressive fatigue, unintentional weight loss of 5 kg, and intermittent abdominal discomfort. On examination, he is pale, with mild epigastric tenderness but no palpable masses. Initial blood tests reveal normocytic anemia, elevated liver enzymes, and a slightly elevated serum creatinine. Preliminary ultrasound of the abdomen shows a heterogeneous liver. Considering these findings, which of the following diagnostic approaches is most appropriate for the registered clinical officer to adopt? Option A. Focus solely on the elevated liver enzymes and order a specific viral hepatitis panel without considering the anemia, weight loss, or renal function. Option B. Advise the patient to rest and rehydrate and repeat the blood tests in 1 month. Assuming the symptoms are transient, Option C. Formulate a differential diagnosis list, prioritizing conditions that explain the constellation of symptoms and abnormal investigations, and plan further targeted investigations to confirm or exclude these possibilities. Option D. Conclude that the patient likely has a primary liver pathology given the ultrasound findings and proceed with treatment for hepatitis. The correct answer is C. Formulate a differential diagnosis list, prioritizing conditions that explain the constellation of symptoms and abnormal investigations, and plan further targeted investigations to confirm or exclude these possibilities. Explanation: this scenario presents a professional challenge due to the potential for delayed or incorrect diagnosis, impacting patient outcomes and trust in the healthcare system. Registered Clinical Officer (RCO) must synthesize diverse clinical information, including patient history, physical examination findings, and preliminary investigations, to formulate an accurate diagnostic impression. This requires a systematic and evidence-based approach, adhering to professional standards and ethical obligations. The correct approach represents best professional practice because it prioritizes a comprehensive and differential diagnosis. This involves systematically considering all plausible conditions that could explain the patient's symptoms and signs, rather than settling on the most obvious or initial impression. This aligns with the RCO's duty of care to provide thorough and competent assessment, as mandated by professional regulatory bodies, which emphasize the importance of accurate diagnosis for effective treatment planning and patient safety. It also reflects the ethical principle of beneficence, acting in the patient's best interest by ensuring all possibilities are explored. An incorrect approach that prematurely concludes a diagnosis without considering other possibilities fails to meet the standard of care. This could lead to misdiagnosis, inappropriate treatment, and potentially serious harm to the patient, constituting a breach of professional duty. Such an approach may also violate regulatory guidelines that require RCOs to maintain up-to-date knowledge and skills, including diagnostic reasoning. Another incorrect approach that relies solely on a single investigation without correlating it with the clinical picture is also professionally unacceptable. Diagnostic investigations are tools to support clinical judgment, not replace it. Over-reliance on one test can lead to misinterpretation, especially if the test has limitations or the patient's presentation is atypical. This can result in diagnostic errors and deviation from evidence-based practice, which is a cornerstone of professional conduct. A further incorrect approach that involves delaying further investigation or consultation when initial findings are inconclusive or concerning is ethically and professionally problematic. The RCO has a responsibility to act in a timely manner to ensure the patient receives appropriate care. Unnecessary delays can worsen the patient's condition and may be viewed as negligence. Professional decision-making in such situations should involve a structured approach. First, gather all available information. Second, develop a list of differential diagnoses. Third, order appropriate investigations to confirm or refute these diagnoses. Fourth, interpret results in the context of the clinical presentation. And fifth, formulate a definitive diagnosis and management plan, seeking senior or specialist input when necessary. Question 5. Upon reviewing a patient's electronic health record, an RCO notes a sensitive diagnosis that was previously undisclosed to the primary treating physician. The RCO believes this information is critical for the patient's ongoing management and wishes to ensure the physician is aware of it. The patient has not explicitly consented to the sharing of this specific diagnosis with the primary physician. What is the most appropriate course of action for the RCO? Option A. Document the diagnosis in a general note within the patient's record, indicating a need for further discussion without revealing the specific details to the treating physician. Option B. Discuss the situation with the patient. Explain the importance of sharing this information with the treating physician for their care, and obtain their explicit consent before proceeding. Option C. Inform the treating physician of the patient's diagnosis immediately, as the information is clinically relevant and essential for patient care, overriding the need for explicit consent in this instance. Option D. Withhold the information from the treating physician to strictly maintain patient confidentiality, assuming the patient has reasons for not disclosing it themselves. The correct answer is B. Discuss the situation with the patient. Explain the importance of sharing this information with the treating physician for their care, and obtain their explicit consent before proceeding. Explanation. This scenario presents a professional challenge due to the RCO's responsibility to maintain patient confidentiality, while also ensuring appropriate clinical care and communication within the healthcare team. The need to balance these competing demands requires careful judgment and adherence to established professional standards and regulatory guidelines. The correct approach represents best professional practice because it prioritizes patient autonomy and informed consent before disclosing sensitive information. This aligns with the ethical principles of respect for persons and beneficence and is mandated by regulatory frameworks governing patient data protection and professional conduct for RCOs. Obtaining consent ensures that the patient is aware of and agrees to the sharing of their information, thereby upholding their right to privacy. An incorrect approach that involves disclosing the patient's condition without consent, even with the intention of facilitating care, represents a significant regulatory and ethical failure. This breaches patient confidentiality, a cornerstone of trust in the healthcare relationship, and violates data protection laws. Such an action undermines patient autonomy and can lead to legal repercussions and damage to the RCO's professional standing. Another incorrect approach, that of withholding information from the treating physician due to a misunderstanding of consent, is also professionally unacceptable. While respecting confidentiality is crucial, failing to share clinically relevant information that directly impacts patient care can lead to suboptimal treatment, diagnostic errors, or adverse events, thereby violating the principle of non-maleficence. This demonstrates a failure in professional communication and a lack of understanding of the RCO's role in collaborative patient management. A further incorrect approach, that of documenting the patient's condition in a general manner without specific details, fails to adequately inform the treating physician of the necessary clinical information. While it attempts to balance confidentiality and communication, it compromises the quality of care by providing insufficient detail for accurate diagnosis and treatment planning. This can indirectly lead to patient harm and is not in line with the RCO's duty of care. The professional decision-making process for similar situations should involve a clear assessment of the information to be shared, the purpose of sharing, and the patient's consent status. If consent is not explicitly obtained, the RCO must consider whether the disclosure falls under legally permissible exceptions, such as immediate risk of harm to the patient or others, and even then, the disclosure should be the minimum necessary. When in doubt, seeking guidance from a supervisor or consulting relevant professional guidelines is essential. Question 6. The performance metrics show a consistent pattern of patients expressing a preference for a less evidence-based pharmacotherapy option over the clinically recommended treatment for a specific chronic condition. As a registered clinical officer, RCO, you are tasked with managing these patients. What is the most ethically sound and professionally responsible approach to address this situation? Option A. Immediately accede to the patient's preferred pharmacotherapy, assuming their choice is based on personal research or anecdotal evidence, and focus on managing any potential side effects that may arise. Option B. Dismiss the patient's preference as uninformed and proceed with the recommended pharmacotherapy, emphasizing the RCO's superior clinical knowledge and experience. Option C. Override the patient's preference and prescribe the clinically recommended pharmacotherapy, as the RCO's primary duty is to ensure adherence to best practice guidelines for optimal patient outcomes. Option D. Engage in a detailed discussion with the patient to understand the reasons for their preference, clearly explain the rationale for the recommended pharmacotherapy, outline the potential benefits and risks of both options, and collaboratively determine the best course of action, ensuring the patient feels heard and informed. The correct answer is D. Engage in a detailed discussion with the patient to understand the reasons for their preference, clearly explain the rationale for the recommended pharmacotherapy, outline the potential benefits and risks of both options, and collaboratively determine the best course of action, ensuring the patient feels heard and informed. Explanation. Scenario analysis. This scenario presents a common ethical dilemma in pharmacotherapy where a clinician's professional judgment is challenged by a patient's expressed preference that conflicts with established best practice guidelines and potential risks. The RCO must balance patient autonomy with their duty of care, ensuring the patient is fully informed while also safeguarding their well-being. The challenge lies in navigating this balance without coercion or undue influence, respecting the patient's right to make decisions about their own health, even if those decisions are not medically optimal. Correct approach analysis. The correct approach involves a thorough, empathetic, and informative discussion with the patient. This includes clearly explaining the rationale behind the recommended pharmacotherapy, detailing the potential benefits and risks of both the recommended treatment and the patient's preferred alternative. It requires assessing the patient's understanding, addressing their concerns, and exploring the underlying reasons for their preference. This aligns with the ethical principles of beneficence, acting in the patient's best interest, non-maleficence, avoiding harm, and respect for patient autonomy. The RCO's role is to empower the patient to make an informed decision, not to dictate it. This approach upholds the RCO's professional responsibility to provide evidence-based care while respecting individual patient values and choices, as mandated by professional codes of conduct and ethical guidelines for healthcare professionals. Incorrect approaches analysis. One incorrect approach involves overriding the patient's preference without adequate exploration of their reasoning or concerns. This violates the principle of patient autonomy and can lead to mistrust and non-adherence. Ethically, it is paternalistic and fails to engage the patient in shared decision-making. Another incorrect approach is to simply accede to the patient's request without fully informing them of the potential risks and benefits of their preferred option compared to the recommended treatment. This fails the duty of care and the principle of beneficence, as the RCO would be allowing a potentially suboptimal or harmful treatment path without ensuring the patient understands the consequences. This is a failure to uphold professional standards of informed consent and patient safety. A third incorrect approach is to dismiss the patient's concerns or preferences as uninformed or irrational without attempting to understand their perspective. This demonstrates a lack of empathy and respect, undermining the therapeutic relationship and potentially alienating the patient from seeking future care. It also fails to identify any underlying factors that might be influencing the patient's decision, such as cultural beliefs, past experiences, or misinformation. Professional reasoning. When faced with a patient preference that diverges from recommended pharmacotherapy, an RCO should employ a structured decision-making process. This begins with active listening to understand the patient's perspective and the reasons behind their preference. Next, the RCO must clearly and comprehensively explain the evidence-based recommendation, including its benefits, risks, and alternatives. Crucially, the RCO must then assess the patient's comprehension of this information and address any questions or misconceptions. The process should culminate in a shared decision-making discussion, where the RCO guides the patient towards the most appropriate course of action, respecting their autonomy while ensuring their safety and well-being. If a patient insists on a course of action that poses significant risk, the RCO must document the discussion thoroughly and consider seeking further consultation or involving a supervisor if necessary. Question 7. Examination of the data shows an increase in patient complaints regarding appointment scheduling and perceived delays in receiving follow-up care. The clinical team is under pressure to improve efficiency and reduce waiting lists, which approach best aligns with the principles of clinical governance for addressing these issues. Option A. Conduct a comprehensive review of current scheduling and follow-up processes involving the multidisciplinary team to identify root causes and implement evidence-based improvements. Option B. Advise the clinical team to manage patient expectations by explaining the current pressures and limitations of the service. Option C. Immediately implement a new appointment booking system that prioritizes speed, aiming to clear the backlog of patients as quickly as possible. Option D. Focus on staff training for improved communication skills, assuming that better communication will resolve most patient concerns about delays. Correct answer is A. Conduct a comprehensive review of current scheduling and follow-up processes involving the multidisciplinary team to identify root causes and implement evidence-based improvements. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires balancing the immediate need for service delivery with the long-term imperative of maintaining high standards of patient care and safety through robust clinical governance. The pressure to meet targets can inadvertently lead to compromises in quality, creating a conflict between operational efficiency and ethical/regulatory obligations. Careful judgment is required to ensure that process optimization does not undermine the fundamental principles of clinical governance. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based review of clinical processes. This aligns directly with the principles of clinical governance, which mandate continuous improvement, risk management, and the assurance of high-quality patient care. By involving the multidisciplinary team, the approach ensures that all perspectives are considered, leading to more effective and sustainable solutions. This proactive and collaborative method is essential for identifying and mitigating potential risks to patient safety and service quality, thereby upholding the RCO's professional and regulatory responsibilities. Incorrect approaches analysis. One incorrect approach focuses solely on reducing patient waiting times without a thorough assessment of the impact on clinical outcomes or staff workload. This fails to adhere to the principle of ensuring high-quality patient care, as speed at the expense of thoroughness can lead to diagnostic errors or suboptimal treatment, violating the RCO's duty of care and potentially breaching regulatory requirements for safe practice. Another incorrect approach involves implementing changes based on anecdotal evidence or the opinions of a few senior staff members, without broader consultation or data analysis. It bypasses the systematic approach to quality improvement mandated by clinical governance. It risks overlooking critical issues, failing to address the root causes of any identified problems, and potentially introducing new risks, thereby contravening the regulatory expectation for evidence-based decision-making and comprehensive risk assessment. A third incorrect approach is to defer any process optimization until a formal audit is scheduled. While audits are important, delaying necessary improvements based on the anticipation of a future event is a failure of proactive clinical governance. It suggests a reactive rather than a continuous improvement mindset, potentially leaving patients exposed to suboptimal care or risks in the interim, which is contrary to the RCO's ongoing responsibility for patient safety and quality assurance. Professional reasoning. Professionals should approach process optimization by first establishing a clear understanding of the current state, identifying specific areas for improvement through data collection and analysis, and then engaging the relevant stakeholders in developing and implementing solutions. This should be followed by monitoring the impact of the changes and iterating as necessary. The decision-making process must always be guided by the principles of clinical governance, prioritizing patient safety, quality of care, and continuous improvement, while adhering to all relevant professional standards and regulatory frameworks. Question 8. Performance analysis shows that the generation of patient discharge summaries is consistently delayed, leading to potential gaps in post-discharge care coordination. Which of the following approaches would best address this process inefficiency while upholding clinical governance standards? Option A. Assign the complete redesign and implementation of the discharge summary process to a single junior administrative assistant. Option B. Introduce a new, advanced electronic health record system that integrates discharge planning functionalities, requiring extensive staff retraining. Option C. Redesign the discharge summary process based on informal discussions with a small group of experienced clinicians. Option D. Develop and implement a standardized electronic discharge summary template with mandatory fields and automated prompts for key information. The correct answer is D. Develop and implement a standardized electronic discharge summary template with mandatory fields and automated prompts for key information. Explanation. Scenario analysis. This scenario presents a common challenge in clinical settings where a specific process, the patient discharge summary generation, is identified as inefficient. The professional challenge lies in selecting the most effective and compliant method for optimization, balancing speed, accuracy, and adherence to clinical governance principles. The need for careful judgment arises from the potential impact on patient care, staff workload, and regulatory compliance. Correct approach analysis. Implementing a standardized electronic discharge summary template with mandatory fields and automated prompts directly addresses the identified inefficiencies. This approach aligns with clinical governance by promoting consistency, accuracy, and completeness in patient records, which is crucial for continuity of care and medico-legal defensibility. The use of electronic systems enhances efficiency and reduces the risk of human error inherent in manual processes. This is best professional practice as it leverages technology to improve a core clinical process, ensuring adherence to standards of care and regulatory requirements for record keeping. Incorrect approaches analysis. Introducing a new, complex software system without adequate training or phased implementation would likely lead to initial disruption, resistance from staff, and potential data integrity issues, undermining the goal of process optimization and potentially violating principles of effective resource management and staff support mandated by clinical governance. Relying solely on anecdotal feedback from a few senior clinicians to redesign the process risks overlooking critical aspects of the workflow and may not reflect the broader operational realities or the needs of all staff involved, thus failing to achieve comprehensive process improvement and potentially contravening the principle of evidence-based decision-making in quality improvement. Delegating the entire redesign and implementation to a single junior staff member without oversight or clear objectives is a failure of leadership and clinical governance. It places an undue burden on the individual, increases the risk of errors or omissions, and bypasses the structured, multidisciplinary approach required for effective quality improvement initiatives, potentially leading to non-compliance with established protocols. Professional reasoning. Professionals should approach process optimization by first conducting a thorough, data-driven analysis of the current state. This should be followed by a collaborative design phase involving all relevant stakeholders. Implementation should be phased, with robust training and ongoing monitoring to ensure effectiveness and compliance. The decision-making process should prioritize patient safety, quality of care, and adherence to all applicable regulatory frameworks and ethical guidelines. Question 9. The assessment process reveals a 65-year-old male presenting with sudden onset of severe, sharp chest pain radiating to his left arm, shortness of breath, and diaphoresis. He has a history of hypertension and hyperlipidemia. The RCO is considering several potential causes for these symptoms. Which of the following approaches to formulating a differential diagnosis is most aligned with best professional practice for a registered clinical officer? Option A. Request a broad range of laboratory and imaging tests without a clear diagnostic hypothesis to see what abnormalities are found. Option B. Prioritize immediate management of the most obvious symptom, chest pain, and initiate treatment for a presumed myocardial infarction without further diagnostic exploration. Option C. Focus solely on the patient's known risk factors for cardiovascular disease and only consider diagnoses directly related to established atherosclerosis. Option D. Develop a comprehensive list of potential diagnoses that could explain the patient's symptoms, including but not limited to myocardial infarction, pulmonary embolism, aortic dissection, and pericarditis, and then plan initial investigations to differentiate between these possibilities. The correct answer is B. Prioritize immediate management of the most obvious symptom, chest pain, and initiate treatment for a presumed myocardial infarction without further diagnostic exploration. Explanation. Scenario analysis. This scenario is professionally challenging because the registered clinical officer, RCO, is presented with a complex patient presentation that mimics several distinct conditions. The RCO must navigate the inherent uncertainty of initial patient encounters, where definitive diagnostic information may be limited. The challenge lies in systematically evaluating potential diagnoses, considering the patient's history, presenting symptoms, and initial examination findings, while also being mindful of the potential for serious underlying pathology that requires prompt recognition and management. The RCO's responsibility extends beyond simply identifying a single cause. It involves a dynamic process of differential diagnosis that prioritizes patient safety and ensures appropriate investigation and treatment pathways are initiated. Correct approach analysis. The correct approach involves a systematic and evidence-based formulation of a differential diagnosis. This means considering a broad range of plausible conditions that could explain the patient's symptoms, ranking them by likelihood and severity, and then outlining the initial investigations and management steps that will help to confirm or refute these possibilities. This aligns with the RCO's professional duty of care, as outlined in the regulatory framework governing RCO practice, which emphasizes the importance of thorough assessment and appropriate diagnostic reasoning. By developing a comprehensive differential, the RCO ensures that no critical diagnoses are overlooked and that the patient receives timely and effective care. This approach is also ethically sound, promoting patient autonomy and beneficence by ensuring that diagnostic uncertainty is managed proactively. Incorrect approaches analysis. One incorrect approach would be to prematurely settle on a single diagnosis based on the most obvious symptom without considering other possibilities. This is a failure of diagnostic reasoning and can lead to misdiagnosis and delayed or inappropriate treatment, violating the RCO's duty of care and potentially contravening regulatory guidelines on competent practice. It demonstrates a lack of critical appraisal of the clinical information. Another incorrect approach would be to dismiss less common but potentially life-threatening conditions without adequate justification. This represents a failure to consider the full spectrum of possibilities and can have severe consequences for patient outcomes. Regulatory frameworks for RCOs typically mandate a diligent approach to patient assessment, which includes considering serious diagnoses even if they are less probable initially. A third incorrect approach would be to initiate extensive and potentially unnecessary investigations without a clear diagnostic rationale derived from a differential diagnosis. This is inefficient, can lead to patient distress and increased healthcare costs, and may not be supported by the RCO's scope of practice or established clinical guidelines. It suggests a lack of structured diagnostic thinking. Professional reasoning. Professionals should approach differential diagnosis formulation by first gathering all available patient information, history, examination, initial observations. They should then brainstorm a comprehensive list of potential diagnoses that could explain the patient's presentation. This list should be prioritized based on the likelihood of each diagnosis and the potential severity of the condition. Subsequently, the RCO should identify the key differentiating features between these diagnoses and plan initial investigations, e.g., laboratory tests, imaging, further questioning, that will help to narrow down the possibilities and guide further management. This iterative process of hypothesis generation, testing, and refinement is central to sound clinical decision-making and is expected within the RCO's professional practice. Question 10. Analysis of the immediate management of a patient who has collapsed and is unresponsive, with no spontaneous breathing, in the context of RCO practice, focusing on the impact of different initial responses on patient outcomes and adherence to established life support protocols. Option A. Administer intravenous fluids and vasopressors without confirming the cardiac rhythm or initiating chest compressions. Option B. Immediately initiate high-quality chest compressions, call for assistance, and attach a defibrillator while preparing for airway management and medication administration as per ACL's guidelines. Option C. Spend several minutes performing a detailed physical examination and gathering a comprehensive patient history before commencing any resuscitation efforts. Option D. Delegate the initiation of chest compressions to a less experienced team member, while the RCO focuses on documenting the event. The correct answer is B. Immediately initiate high-quality chest compressions, call for assistance, and attach a defibrillator while preparing for airway management and medication administration as per ACL's guidelines. Explanation. Scenario analysis. This scenario presents a critical situation where a registered clinical officer, RCO, must rapidly assess and manage a patient experiencing cardiac arrest. The challenge lies in the immediate need for effective intervention, the potential for rapid deterioration, and the requirement to adhere strictly to established basic life support, BLS, and advanced cardiac life support ACLs, protocols, which are mandated by the regulatory framework governing RCO practice. The RCO must balance the urgency of the situation with the need for accurate assessment and appropriate intervention, all while maintaining patient dignity and safety. Correct approach analysis. The correct approach involves immediate recognition of cardiac arrest, prompt initiation of high-quality cardiopulmonary resuscitation, CPR, with minimal interruptions, and rapid administration of appropriate advanced interventions as per established ACL's guidelines. This includes early defibrillation if indicated, securing an airway, and administering medications. This approach is best professional practice because it directly aligns with the RCO's scope of practice and the legal and ethical obligations to provide timely and evidence-based care in life-threatening emergencies. Adherence to these protocols is a fundamental requirement of the RCO regulatory framework, ensuring patient safety and maximizing the chances of survival and recovery. Incorrect approaches analysis. One incorrect approach would be to delay CPR to perform a prolonged or overly detailed diagnostic assessment before initiating chest compressions. This is a regulatory and ethical failure because it violates the core principle of BLS/ACLs, which prioritizes immediate chest compressions in suspected cardiac arrest. Delaying CPR significantly reduces the likelihood of successful resuscitation and is contrary to the RCO's duty of care. Another incorrect approach would be to administer medications without first establishing an advanced airway or ensuring adequate ventilation, or to administer medications not recommended by current ACL's guidelines for the specific rhythm. This represents a failure to follow established protocols, which are legally binding for RCOs. Such actions could be ineffective, harmful, and constitute a breach of professional standards and potentially regulatory requirements for appropriate drug administration and procedural competence. A further incorrect approach would be to cease resuscitation efforts prematurely without a clear indication or consultation as per established protocols. This would be an ethical and regulatory failure as it abandons the patient without exhausting all reasonable and evidence-based interventions, potentially violating the RCO's duty to preserve life and provide care. Professional reasoning. When faced with a suspected cardiac arrest, the RCO should follow a structured decision-making process. 1. Assess for responsiveness and breathing. 2. If unresponsive and not breathing normally, call for help and immediately begin high-quality chest compressions. 3. Attach a defibrillator as soon as possible and follow its prompts. 4. Manage the airway and ventilation. 5. Administer appropriate ACLS medications based on the identified rhythm. 6. Continuously reassess the patient and the effectiveness of interventions. This systematic approach ensures that critical interventions are not missed and that care is delivered in accordance with regulatory mandates and best practices. Question 11. The assessment process reveals that your knowledge regarding the latest evidence-based management strategies for chronic respiratory conditions may be outdated, potentially impacting your clinical decision-making in this area. You have a busy clinical schedule, but recognize the importance of staying current. Which of the following actions best demonstrates proactive and compliant continuous professional development, CPD? Option A. Attend a general medical conference that includes a broad overview of various specialties, hoping to pick up relevant information incidentally. Option B. Wait until a patient case highlights this deficiency, then research the relevant information for that specific patient. Option C. Discuss the latest management approaches informally with senior colleagues during breaks, without formal record keeping. Option D. Undertake a recognized online course or attend a professional workshop specifically focused on advancements in chronic respiratory disease management and document your learning. Correct answer is D. Undertake a recognized online course or attend a professional workshop specifically focused on advancements in chronic respiratory disease management and document your learning. Explanation. Scenario analysis. This scenario presents a common challenge for registered clinical officers, RCO, regarding the maintenance of their professional competence. The RCO is faced with a situation where their current knowledge base may be outdated, potentially impacting the quality and safety of patient care. The challenge lies in balancing existing workload with the imperative to engage in continuous professional development, CPD, a core requirement for maintaining registration and ensuring up-to-date practice. The RCO must make a proactive decision to address this knowledge gap, rather than waiting for a specific incident or formal reprimand. Correct approach analysis. The correct approach involves proactively identifying a relevant CPD activity that directly addresses the identified knowledge gap. This demonstrates a commitment to lifelong learning and patient safety, which are fundamental ethical and regulatory principles for RCOs. By choosing a structured learning opportunity, such as attending a workshop or completing an online module on the latest advancements in managing chronic respiratory conditions, the RCO is actively working to enhance their skills and knowledge. This aligns with the regulatory framework for RCOs, which mandates ongoing professional development to ensure practitioners remain competent and provide evidence-based care. This proactive stance is crucial for maintaining public trust and upholding the standards of the profession. Incorrect approaches analysis. One incorrect approach is to delay engaging in CPD until a specific patient complication arises or a formal performance review highlights the deficiency. This is a reactive and potentially harmful strategy. It fails to meet the proactive requirements of CPD, which aims to prevent such issues. Ethically, it compromises patient safety by continuing to practice with potentially suboptimal knowledge. Regulatorily, it could be seen as a failure to adhere to the spirit, if not the letter, of CPD requirements. Another incorrect approach is to engage in CPD that is not relevant to the identified knowledge gap or the RCO's scope of practice. For instance, attending a seminar on a completely unrelated medical specialty would not address the deficiency in managing chronic respiratory conditions. This approach is inefficient and demonstrates a lack of strategic thinking regarding professional development. It fails to meet the core purpose of CPD, which is to improve competence in one's practice area. Ethically, it is a superficial engagement with professional development, and regulatorily would likely not be considered sufficient to meet CPD obligations. A further incorrect approach is to rely solely on informal learning, such as casual discussions with colleagues, without structured learning or documentation. While informal learning has its place, it often lacks the depth, breadth, and verifiable outcomes required for formal CPD. The regulatory framework typically requires documented evidence of CPD activities. Relying solely on informal learning risks not meeting these documentation requirements and may not provide the comprehensive update needed. Ethically, it could lead to a false sense of competence, and regulatorily, it would likely be deemed insufficient for fulfilling CPD mandates. Professional reasoning. When faced with a potential knowledge gap, an RCO should employ a structured decision-making process. First, acknowledge the potential gap and its implications for patient care. Second, identify specific areas where knowledge or skills may be lacking. Third, research and select appropriate CPD activities that directly address these identified areas, considering their relevance, accreditation, and potential for measurable learning outcomes. Fourth, plan for the time and resources needed to undertake the CPD. Fifth, engage in the CPD activity with a focus on learning and application. Finally, document the CPD activity and reflect on how the learning will be integrated into practice. This systematic approach ensures that CPD is purposeful, effective, and compliant with professional standards. Question 12. The assessment process reveals a 65-year-old male presenting with progressive dyspnea, orthopnea, and bilateral lower extremity edema. Physical examination notes bibasilar crackles, an S3 gallop, and jugular venous distension. Echocardiography shows a reduced ejection fraction of 35% and significant left ventricular dilation. Which of the following pathophysiological mechanisms is the primary driver of this patient's presentation? Option A. Pulmonary embolism leading to increased pulmonary vascular resistance and right ventricular strain. Option B. Chronic obstructive pulmonary disease exacerbation causing hypoxemia and increased work of breathing. Option C. Impaired myocardial contractility leading to reduced stroke volume and increased end diastolic pressure. Option D. Valvular stenosis causing increased afterload and subsequent left ventricular hypertrophy. The correct answer is C. Impaired myocardial contractility leading to reduced stroke volume and increased end diastolic pressure. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misinterpreting complex pathophysiological findings, which can lead to incorrect diagnoses and inappropriate treatment plans. The RCO must integrate knowledge of disease processes with clinical presentation and diagnostic data, requiring careful judgment to avoid diagnostic errors and ensure patient safety. The challenge lies in discerning the primary pathological driver from secondary effects and considering the interplay of multiple potential conditions. Correct approach analysis. The correct approach involves a systematic and evidence-based evaluation of the patient's signs, symptoms, and diagnostic results to identify the underlying pathophysiological mechanisms. This aligns with the RCO's professional responsibility to provide competent and ethical care, as mandated by the regulatory framework governing registered clinical officers. Best professional practice dictates a thorough understanding of disease processes, their manifestations, and the principles of differential diagnosis. This ensures that interventions are targeted at the root cause, maximizing therapeutic efficacy and minimizing harm. Adherence to established clinical guidelines and a commitment to continuous professional development are also critical components of this approach, ensuring care is up to date and aligned with current best practices. Incorrect approach is analysis. An approach that relies solely on superficial symptom matching without delving into the underlying pathophysiology risks misdiagnosis. This fails to meet the professional standard of care and could lead to prescribing treatments that are ineffective or even detrimental, violating ethical obligations to the patient. Focusing exclusively on a single, obvious symptom while ignoring other presenting signs and their potential pathophysiological links represents a failure to conduct a comprehensive assessment, which is a core regulatory requirement for RCOs. Furthermore, adopting a treatment based on anecdotal evidence or personal preference rather than established pathophysiological understanding and clinical evidence constitutes a significant ethical and regulatory breach, potentially leading to patient harm and professional misconduct. Professional reasoning. Professionals should employ a structured decision-making process that begins with a comprehensive history and physical examination. This is followed by the critical analysis of all available diagnostic data, integrating it with the patient's presentation to formulate a differential diagnosis based on likely pathophysiological mechanisms. Each potential diagnosis should be weighed against the evidence, and further investigations should be ordered judiciously to confirm or refute hypotheses. Treatment plans should be developed based on the confirmed or most probable diagnosis, with clear objectives and monitoring strategies. Regular review and reevaluation are essential to adapt the plan as the patient's condition evolves. This systematic approach ensures that decisions are evidence-based, patient-centered, and compliant with regulatory and ethical standards. Question 13. Research into a new evidence-based guideline for managing a common chronic condition has revealed a significantly improved patient outcome profile compared to the current standard of care practiced within your department. However, the implementation of this new guideline requires a shift in established workflows and the adoption of new diagnostic criteria by the clinical team. What is the most appropriate professional approach to integrate this new evidence into practice? Option A. Dismiss the new guidelines as too difficult to implement given the current workload and existing practices. Option B. Initiate a discussion with the clinical team, presenting the research and guidelines, and propose a pilot implementation of the new approach. Option C. Wait for a formal directive from hospital management or a senior clinician before considering the adoption of the new guidelines. Option D. Unilaterally implement the new guidelines in your own practice immediately, regardless of the team's current workflow. The correct answer is B. Initiate a discussion with the clinical team, presenting the research and guidelines, and propose a pilot implementation of the new approach. Explanation. This scenario presents a common challenge in healthcare settings: the gap between established evidence-based practice and routine clinical application. The professional challenge lies in navigating the inertia of existing practices, potential resistance to change from colleagues, and the practicalities of integrating new guidelines into a busy workload. Careful judgment is required to ensure patient safety and quality of care are paramount, while respecting the established professional environment. The correct approach represents best professional practice because it directly addresses the implementation of evidence-based guidelines in a structured and collaborative manner. By initiating a discussion with the clinical team, presenting the relevant research and guidelines, and proposing a pilot implementation, the professional demonstrates a commitment to improving patient outcomes through scientifically validated methods. This aligns with the core principles of evidence-based practice, which mandate the integration of best available evidence with clinical expertise and patient values. Furthermore, it respects the professional autonomy and collective responsibility of the healthcare team, fostering a culture of continuous learning and quality improvement, which is implicitly or explicitly supported by professional regulatory frameworks governing clinical officers. An incorrect approach that involves unilaterally implementing the new guidelines without consultation would be professionally unacceptable. This disregards the expertise and experience of colleagues, potentially leading to friction and undermining team cohesion. Ethically, it fails to respect the collaborative nature of patient care and the shared responsibility for decision-making. From a regulatory perspective, while not always a direct violation, it could be seen as a failure to uphold professional standards of communication and teamwork, which are often implicit in the broader ethical codes governing healthcare professionals. Another incorrect approach, that of dismissing the new guidelines due to the perceived difficulty of implementation, represents a failure to uphold the duty of care. Evidence-based practice is not optional. It is a cornerstone of competent and ethical healthcare delivery. Ignoring well-established guidelines, even if they require effort to integrate, can lead to suboptimal patient care and potentially adverse outcomes. This approach demonstrates a lack of commitment to professional development and patient well-being, which would be a significant ethical and potentially regulatory failing. A further incorrect approach, that of waiting for a formal directive from management before considering the new guidelines, abdicates professional responsibility. While formal directives can be helpful, clinical officers are expected to be proactive in identifying and implementing best practices. Relying solely on top-down mandates can lead to delays in adopting beneficial changes, thereby compromising patient care. This passive stance fails to demonstrate the initiative and critical thinking expected of a registered clinical officer. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the evidence. Recognize and critically appraise relevant research and established guidelines. 2. Assess applicability. Determine how the evidence applies to the specific patient population and clinical context. 3. Engage stakeholders. Discuss findings and potential changes with colleagues, seeking their input and addressing concerns. 4. Propose implementation. Develop a practical plan for integrating the new practice, potentially starting with a pilot. 5. Monitor and evaluate. Track the effectiveness of the implemented changes and make adjustments as needed. 6. Advocate for change. If necessary, escalate concerns or proposals through appropriate channels to ensure widespread adoption of best practices. Question 14. Market research demonstrates that patients presenting with worsening shortness of breath and increased cough in the context of a known chronic respiratory condition often have complex presentations. A 68-year-old male with a history of moderate COPD presents to the clinic with a 3-day history of increased dyspnea, productive cough with yellowish sputum, and a subjective fever. His baseline dyspnea is typically mild to moderate. Which of the following diagnostic and management approaches best reflects best professional practice for this patient? Option A. Prescribe an anxiolytic medication to manage the patient's perceived distress from breathlessness and advise deep breathing exercises. Option B. Order a chest X-ray, complete blood count and C-reactive protein, and consider initiating antibiotics if signs of bacterial infection are present, while also managing his COPD symptoms. Option C. Immediately admit the patient to the hospital for intensive respiratory support based on the reported increase in dyspnea. Option D. Initiate empiric treatment for a COPD exacerbation with bronchodilators and systemic corticosteroids, and advise the patient to monitor symptoms at home. The correct answer is D. Initiate empiric treatment for a COPD exacerbation with bronchodilators and systemic corticosteroids, and advise the patient to monitor symptoms at home. Explanation. Scenario analysis. This scenario presents a challenge in distinguishing between acute exacerbation of a chronic condition and a new, unrelated pathological process. The RCO must integrate knowledge of organ system pathophysiology with clinical presentation and diagnostic findings to arrive at an accurate diagnosis and appropriate management plan. Misinterpreting the underlying cause can lead to delayed or incorrect treatment, potentially worsening patient outcomes and violating the duty of care. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's history, physical examination findings, and diagnostic test results to identify the primary driver of the symptoms. This aligns with best professional practice by prioritizing a thorough and evidence-based assessment. Specifically, it requires understanding the typical pathophysiology of chronic obstructive pulmonary disease, COPD, exacerbations, which often involve increased inflammation and mucus production in the airways, leading to worsening dyspnea, cough, and sputum production. Differentiating this from a new pneumonia, which would typically present with focal consolidation and potentially different inflammatory markers, is crucial. Adherence to established clinical guidelines for COPD management and diagnostic workup for respiratory distress is paramount, reflecting the RCO's responsibility to provide competent and safe patient care as mandated by the regulatory framework governing registered clinical officers. Incorrect approach is analysis. One incorrect approach would be to solely focus on the patient's known history of COPD and assume all new symptoms are part of an exacerbation without further investigation. This fails to acknowledge that patients with chronic conditions can develop new, independent illnesses. Ethically, this represents a failure to provide comprehensive care and a potential breach of the duty of care by overlooking a potentially serious, distinct condition like pneumonia. Regulatorily, it could be seen as a failure to adhere to diagnostic standards and a lack of due diligence. Another incorrect approach would be to immediately initiate aggressive treatment for pneumonia based on a single symptom, such as increased cough, without a comprehensive assessment. This bypasses the diagnostic process and could lead to unnecessary antibiotic use, potential side effects, and a delay in addressing the true underlying cause if it is indeed a COPD exacerbation. This approach demonstrates a lack of critical thinking and a deviation from evidence-based practice, potentially violating professional conduct standards. A third incorrect approach might involve attributing the symptoms solely to anxiety or a psychosomatic response without ruling out organic causes. While psychological factors can influence symptom perception, it is unethical and professionally negligent to dismiss physical complaints without a thorough medical workup. This approach risks misdiagnosis and failure to treat a potentially life-threatening condition, directly contravening the RCO's obligation to investigate and manage physical ailments. Professional reasoning. Professionals should employ a structured diagnostic approach. This involves 1. Gathering a comprehensive history, including the onset, duration, and character of symptoms, as well as any precipitating factors. 2. Performing a thorough physical examination, focusing on vital signs, respiratory status, and signs of infection or inflammation. 3. ordering appropriate investigations such as chest x-rays, blood tests, e.g., complete blood count, C-reactive protein, and potentially sputum cultures to differentiate between conditions. 4. Correlating all findings to formulate a differential diagnosis and then a definitive diagnosis. 5. Developing a management plan based on the confirmed diagnosis and established clinical guidelines, with ongoing monitoring and reassessment. Question 15. Strategic planning requires a registered clinical officer, RCO, to consider potential future scenarios. An RCO is assessing a patient who has recently experienced a significant personal loss and is exhibiting symptoms suggestive of a depressive episode, including low mood, anhedonia, and significant weight loss. The patient expresses feelings of hopelessness and worthlessness. During the assessment, patient makes a vague statement about not wanting to be a burden anymore and wanting it all to end. The RCO needs to determine the most appropriate course of action to ensure the patient's safety while respecting their rights. Option A. Advise the patient that their feelings are normal given their circumstances and encourage them to focus on positive aspects of their life, assuming the statements are expressions of distress rather than suicidal intent. Option B. Document the patient's statements in the medical record and advise the patient to seek further help from their general practitioner at their next scheduled appointment, without any immediate intervention. Option C. Conduct a detailed risk assessment for suicide, exploring the patient's intent, plan, and access to means, and if significant risk is identified, develop a safety plan in collaboration with the patient, involving appropriate support services and potentially informing designated family members with the patient's consent where possible. Option D. Immediately contact the patient's family to inform them of the patient's statements and concerns, urging them to take the patient to a hospital for psychiatric evaluation without further assessment by the RCO. Correct answer is C. Conduct a detailed risk assessment for suicide, exploring the patient's intent, plan, and access to means, and if significant risk is identified, develop a safety plan in collaboration with the patient, involving appropriate support services and potentially informing designated family members with the patient's consent where possible. Explanation. This scenario presents a significant ethical dilemma for a registered clinical officer, RCO, concerning patient confidentiality, duty of care, and the potential for harm. The challenge lies in balancing the patient's right to privacy with the RCO's responsibility to ensure the safety of others, particularly when the patient's mental state may pose a risk. The RCO must navigate complex ethical principles and professional guidelines to make a decision that upholds both patient welfare and public safety. The correct approach involves a thorough, objective assessment of the patient's mental health condition, focusing on the presence of specific risk factors for harm to self or others. This aligns with the RCO's professional duty of care as outlined in the regulatory framework governing RCOs, which mandates acting in the best interests of the patient, while also considering the wider public interest. Confidentiality is not absolute and can be breached when there is a clear and imminent risk of serious harm. The RCO must document their assessment meticulously, including the rationale for any decision made regarding disclosure or further intervention. This approach prioritizes evidence-based practice and ethical decision-making, ensuring that actions are proportionate to the identified risks. An incorrect approach would be to immediately breach confidentiality without a comprehensive assessment. This fails to respect the patient's autonomy and right to privacy, potentially damaging the therapeutic relationship and leading to distrust in healthcare professionals. Such an action could be seen as a failure to adhere to the principles of informed consent and confidentiality, which are cornerstones of professional conduct for RCOs. Another incorrect approach would be to do nothing, despite having concerns about potential harm. This constitutes a dereliction of the RCO's duty of care. The regulatory framework expects RCOs to take appropriate action when a patient's mental health condition presents a foreseeable risk of harm. Failing to act could have severe consequences for the patient or others and would be a serious professional failing. A further incorrect approach might be to rely solely on the patient's self-reporting without independent verification or further assessment, especially if there are indicators of impaired judgment or insight. While patient self-reporting is important, the RCO's professional responsibility includes objective assessment and, where necessary, seeking additional information to ensure a comprehensive understanding of the situation and the associated risks. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the ethical and professional obligations. 2. Gather all relevant information through a comprehensive assessment, including direct observation, patient history, and if appropriate and consented to, information from family or other healthcare providers. 3. Evaluate the identified risks, considering the likelihood and severity of potential harm. 4. Consult with supervisors or experienced colleagues if the situation is complex or uncertain. 5. Make a decision based on the assessment and professional judgment, ensuring it is proportionate to the identified risks and aligns with regulatory and ethical guidelines. 6. Document the entire process, including the assessment, decision-making rationale, and any actions taken. Question 16. Which approach would be most effective for a registered clinical officer, RCO, in managing a patient's long-term medication regimen for type 2 diabetes, considering the patient's reported difficulty in remembering to take their pills and their limited understanding of the medication's purpose? Option A. Prescribe a more potent medication that requires less frequent dosing, assuming this will overcome the patient's adherence issues. Option B. Provide a detailed pamphlet on diabetes management and medication adherence, expecting the patient to independently implement the recommendations. Option C. Collaboratively develop a simplified medication schedule with the patient, incorporating visual aids and setting regular reminders, while also explaining the importance of each medication in managing their diabetes. Option D. Focus solely on adjusting the insulin dosage based on recent blood glucose readings, without addressing the oral medication adherence. Correct answer is C. Collaboratively develop a simplified medication schedule with the patient, incorporating visual aids and setting regular reminders, while also explaining the importance of each medication in managing their diabetes. Explanation. Scenario analysis. Managing medication for patients with chronic diseases presents a significant professional challenge due to the long-term nature of these conditions, the potential for polypharmacy, the need for ongoing patient adherence, and the dynamic interplay between the disease, its treatment, and the patient's overall health status. The registered clinical officer, RCO, must balance efficacy, safety, patient autonomy, and resource utilization within the established regulatory framework. This scenario requires careful judgment to ensure patient well-being and adherence to professional standards. Correct approach analysis. The correct approach involves a collaborative, patient-centered strategy that prioritizes shared decision-making and addresses the patient's individual circumstances. This aligns with the RCO's professional duty of care and ethical obligations to promote patient autonomy and well-being. By actively involving the patient in understanding their treatment plan, identifying barriers to adherence, and tailoring the regimen to their lifestyle and preferences, the RCO fosters a therapeutic alliance. This approach is supported by the principles of good clinical practice, which emphasize patient education, empowerment, and the development of realistic, sustainable medication management strategies. It also implicitly adheres to guidelines that promote adherence and optimize outcomes in chronic disease management. Incorrect approach is analysis. Adopting a purely directive approach, where the RCO dictates the medication regimen without significant patient input, fails to acknowledge the patient's role in their own care and can lead to poor adherence and suboptimal outcomes. This approach risks violating the ethical principle of autonomy and may not align with regulatory expectations for patient engagement in treatment planning. Implementing a regimen solely based on the latest clinical guidelines without considering the patient's specific context, such as their ability to afford medications, their understanding of the instructions, or their existing social support, can create insurmountable barriers to adherence. This overlooks the practical realities of patient life and can lead to treatment failure, potentially contravening the RCO's duty to provide appropriate and effective care. Focusing exclusively on the pharmacological aspects of treatment without addressing the psychosocial factors that influence medication management, such as mental health, social determinants of health, or family dynamics, presents an incomplete picture. This narrow focus can lead to missed opportunities for intervention and may not adequately support the patient in managing their chronic condition effectively, potentially falling short of the comprehensive care expected of an RCO. Professional reasoning. Professionals should adopt a systematic approach to medication management in chronic diseases. This involves 1. Comprehensive assessment of the patient's condition, including comorbidities, current medications. and potential drug interactions. 2. Thorough evaluation of the patient's understanding of their condition and treatment, their adherence history, and any barriers they face. 3. Collaborative development of a medication plan, involving shared decision-making with the patient, considering their preferences, lifestyle, and resources. 4. Regular monitoring and review of the medication regimen, adjusting as necessary based on patient response, adherence, and evolving clinical needs. 5. Ongoing patient education and support to reinforce understanding and promote adherence. This framework ensures that care is individualized, effective, and ethically sound. Question 17. The review process indicates a recurring pattern of medication errors related to dosage calculation in a specific patient demographic. As a registered clinical officer, which of the following frameworks would be the most appropriate to systematically address and improve this quality issue? Option A. Relying solely on individual clinician experience and informal peer discussions to correct the errors. Option B. Implementing a new, complex dosage calculation algorithm immediately across all clinical areas without prior testing. Option C. Delegating the entire responsibility for resolving medication errors to the nursing staff without direct RCO involvement in the improvement process. Option D. Developing and implementing a structured quality improvement project, potentially utilizing Plan Do Study Act (PDSA) cycles to identify root causes, test intervention, and measure outcomes. The correct answer is B. Implementing a new, complex dosage calculation algorithm immediately across all clinical areas without prior testing. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a registered clinical officer, RCO, to move beyond simply identifying a quality issue to actively implementing a systematic approach for improvement. The challenge lies in selecting the most appropriate framework for quality improvement that aligns with the RCO's responsibilities and the regulatory expectations for patient care within the specified jurisdiction. The RCO must consider the potential impact on patient safety, resource allocation, and the need for evidence-based practice, all while adhering to professional standards. Correct approach analysis. The correct approach involves utilizing a structured quality improvement framework that emphasizes data collection, analysis, and iterative testing of interventions. This aligns with the RCO's professional duty to ensure high-quality patient care. Such frameworks, like Plan Do Study Act (PDSA) cycles, are designed to systematically identify root causes of problems, test potential solutions in a controlled manner, and then implement successful changes broadly. This approach is best professional practice because it is evidence-based, promotes continuous learning, and is often implicitly or explicitly supported by regulatory guidelines that mandate quality assurance and patient safety initiatives. It allows for measurable improvements and reduces the risk of implementing ineffective or harmful changes. Incorrect approaches analysis. One incorrect approach would be to rely solely on anecdotal evidence or personal experience to implement changes. This fails to meet the regulatory expectation for evidence-based practice and can lead to the perpetuation of suboptimal care or the introduction of new risks. It lacks the systematic rigor required for effective quality improvement and does not provide a mechanism for measuring the impact of interventions. Another incorrect approach would be to implement a significant change without prior testing or a clear plan for evaluation. This is a high-risk strategy that could negatively impact patient care, waste resources, and potentially violate professional standards that require a cautious and evidence-driven approach to practice modification. It bypasses the crucial steps of risk assessment and controlled implementation inherent in robust quality improvement methodologies. A third incorrect approach would be to delegate the entire quality improvement process to junior staff without adequate oversight or guidance. While delegation is a management tool, the ultimate responsibility for patient care quality rests with the RCO. Failing to actively engage in or oversee the quality improvement process demonstrates a dereliction of professional duty and a disregard for the regulatory framework governing RCO practice. Professional reasoning. Professionals facing such situations should adopt a systematic decision-making process. First, clearly define the quality issue identified. Second, research and select an appropriate quality improvement framework that is evidence-based and aligns with professional standards and regulatory requirements. Third, develop a detailed plan for data collection and analysis to understand the root cause of the issue. Fourth, Design and pilot potential interventions using a structured approach, such as PDSA cycles, to test their effectiveness and safety. Fifth, evaluate the results of the pilot interventions and, if successful, plan for broader implementation. Finally, establish ongoing monitoring mechanisms to sustain the improvements and identify further opportunities for enhancement. This iterative and data-driven process ensures that quality improvement efforts are effective, safe, and compliant with professional and regulatory obligations. Question 18. The analysis reveals that Mr. Davies, a 72-year-old gentleman, presents with increasing shortness of breath. His medical history is significant for type 2 diabetes, hypertension, chronic obstructive pulmonary disease, COPD, and a recent diagnosis of atrial fibrillation. He is currently on multiple medications for these conditions. As the registered clinical officer responsible for his primary care, which of the following approaches best addresses the potential impact of his comorbidities on his current presentation and overall management? Option A. Initiate a trial of a new bronchodilator and advise on lifestyle modifications, assuming the shortness of breath is an exacerbation of his known COPD. Option B. Conduct a thorough review of all his current medications for potential interactions or side effects, assess for signs of heart failure, and consider further investigations to differentiate between cardiac and pulmonary causes of his dyspnea, while coordinating with his cardiologist and pulmonologist. Option C. Prescribe a short course of oral corticosteroids to manage the presumed COPD exacerbation and schedule a follow-up appointment in 2 weeks without further immediate investigation. Option D. Refer Mr. Davies immediately to a respiratory specialist for a definitive diagnosis and management plan, deferring any immediate treatment until their assessment. The correct answer is A. Initiate a trial of a new bronchodilator and advise on lifestyle modifications, assuming the shortness of breath is an exacerbation of his known COPD. Explanation: this scenario presents a professionally challenging situation due to the complex interplay of multiple chronic conditions in a single patient, which can significantly complicate diagnosis, treatment planning, and overall management. The registered clinical officer, RCO, must exercise careful judgment to ensure patient safety, optimize therapeutic outcomes, and adhere to professional standards of care. The correct approach involves a comprehensive, multidisciplinary assessment and management strategy. This aligns with best professional practice by prioritizing holistic patient care, as mandated by the RCO's Professional Code of Conduct and relevant healthcare regulations, that emphasize individualized care plans and the importance of considering all contributing factors to a patient's health status. It ensures that the RCO is not only addressing the immediate presenting complaint, but also proactively managing the patient's chronic conditions to prevent exacerbations and improve quality of life. An incorrect approach of focusing solely on the most prominent symptom without adequately investigating or managing the underlying comorbidities represents a failure to provide comprehensive care. This could lead to suboptimal treatment, potential drug interactions, and a decline in the patient's overall health, violating the RCO's duty of care. Another incorrect approach of over-reliance on a single specialist's opinion without integrating it into a broader care plan neglects the RCO's responsibility to coordinate care and consider the patient as a whole. This can result in fragmented care and missed opportunities for synergistic treatment. A further incorrect approach of delaying or avoiding necessary investigations due to the complexity of comorbidities demonstrates a lack of professional diligence and a failure to uphold the principle of acting in the patient's best interest. This can lead to delayed diagnosis and treatment of potentially serious conditions. Professionals should employ a systematic decision-making framework that includes thorough patient history, physical examination, and a review of all existing medical records. This should be followed by a differential diagnosis that accounts for all presenting symptoms and known comorbidities. Collaborative discussion with other healthcare professionals, including specialists, is crucial for developing an integrated management plan. Regular reassessment and adjustment of the care plan based on the patient's response and evolving condition are essential components of effective management. Question 19. Strategic planning requires a registered clinical officer to critically evaluate therapeutic options for a patient presenting with a new diagnosis. When considering two equally effective antibiotic classes for a common infection, what comparative analysis of their pharmacokinetic and pharmacodynamic profiles is most crucial for optimal patient management? Option A. Assessing their historical prescribing trends and the availability of generic formulations. Option B. Comparing their spectrum of activity against common pathogens and their potential for causing dose-dependent adverse effects. Option C. Determining their brand name recognition and the marketing strategies employed by pharmaceutical companies. Option D. Evaluating their cost-effectiveness and the ease of administration for the patient. The correct answer is B. Comparing their spectrum of activity against common pathogens and their potential for causing dose-dependent adverse effects. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent variability in patient responses to medications, even within the same drug class. A registered clinical officer, RCO, must balance the need for effective treatment with the potential for adverse drug reactions and drug interactions. The challenge lies in predicting and managing these individual patient responses, which are governed by complex pharmacokinetic and pharmacodynamic principles, while adhering to established clinical guidelines and ensuring patient safety. This requires a nuanced understanding beyond simple drug selection, necessitating consideration of patient-specific factors. Correct approach analysis. The correct approach involves a comparative analysis of the pharmacokinetic and pharmacodynamic profiles of different drug options, considering the specific patient's clinical presentation, comorbidities, and concurrent medications. This aligns with best professional practice by prioritizing evidence-based decision-making and patient-centered care. Regulatory frameworks for RCOs emphasize the importance of selecting appropriate treatments based on a thorough understanding of drug actions and patient factors to ensure efficacy and minimize harm. This approach directly addresses the core competencies expected of an RCO in managing patient pharmacotherapy. Incorrect approaches analysis. Selecting a drug solely based on its common prescribing frequency or its availability without considering individual patient pharmacokinetics and pharmacodynamics is a significant regulatory and ethical failure. This approach neglects the RCO's responsibility to individualize patient care and can lead to suboptimal treatment outcomes, increased risk of adverse events, or drug interactions. It demonstrates a lack of critical appraisal of available therapeutic options and a failure to adhere to the principle of do no harm. Furthermore, relying on anecdotal evidence or personal preference over established pharmacokinetic and pharmacodynamic principles violates professional standards and can be considered a breach of duty of care. Professional reasoning. Professionals should employ a systematic decision-making process when selecting pharmacotherapy. This involves 1. Thoroughly assessing the patient's condition, including their medical history, current symptoms, and any relevant physiological factors, e.g., age, renal or hepatic function. 2. Reviewing available therapeutic options, critically evaluating their pharmacokinetic absorption, distribution, metabolism, excretion, and pharmacodynamic mechanism of action, therapeutic effect, adverse effects properties. 3. Considering potential drug interactions with the patient's existing medications. 4. Selecting the most appropriate drug based on the comparative analysis, prioritizing efficacy, safety, and patient-specific factors. 5. Establishing a plan for monitoring the patient's response and potential adverse effects, and being prepared to adjust the treatment regimen as needed. Question 20. Governance review demonstrates that a junior nurse requests immediate venipuncture and initiation of intravenous therapy for a patient, stating the doctor wants it done. However, the RCO has not seen the patient or received a specific written order detailing the indication for the therapy. What is the most appropriate course of action for the registered clinical officer? Option A. Delegate the task to another available healthcare professional to expedite the process. Option B. Seek immediate clarification from the requesting doctor to confirm the clinical indication and obtain a written order before proceeding. Option C. Proceed with the venipuncture and intravenous therapy as requested, assuming the doctor's order is valid. Option D. Politely refuse the request, stating that the RCO cannot act on verbal instructions without a written order. The correct answer is C. Proceed with the venipuncture and intravenous therapy as requested, assuming the doctor's order is valid. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing patient safety, adherence to established clinical protocols, and effective communication within a healthcare team. The RCO must make a critical judgment call regarding the appropriateness of a procedure based on incomplete information and potential risks. The challenge lies in ensuring that patient care is not compromised due to haste or a lack of thorough assessment, while also respecting the urgency that may be implied by the request. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient safety and evidence-based care. By seeking clarification and confirming the indication for venipuncture and intravenous therapy, the RCO adheres to the fundamental principle of do no harm. This aligns with the regulatory framework for registered clinical officers, which mandates that all procedures are performed only when clinically indicated and with appropriate patient assessment. It also reflects ethical obligations to ensure competence and to act in the best interest of the patient. This approach ensures that the RCO is acting on accurate information and has considered all relevant factors before proceeding, thereby minimizing the risk of adverse events. Incorrect approach is analysis. One incorrect approach involves proceeding with the venipuncture and intravenous therapy without further clarification. This is a significant regulatory and ethical failure. It bypasses the essential step of clinical indication and assessment, potentially leading to unnecessary procedures, patient harm e.g., infection, phlebitis, fluid overload, and a breach of professional accountability. Such an action would contraindicate the RCO's duty to provide safe and effective care as outlined in the RCO's scope of practice and professional conduct guidelines. Another incorrect approach is to refuse the request outright without attempting to understand the underlying clinical need or seeking alternative solutions. While caution is necessary, an outright refusal without investigation can impede timely patient care and demonstrate a lack of collaborative spirit within the healthcare team. This could be seen as a failure to uphold the RCO's responsibility to contribute to patient well-being and to work effectively with other healthcare professionals. A further incorrect approach is to delegate the task to an unqualified individual or to proceed without ensuring proper sterile technique and equipment. This represents a severe breach of regulatory requirements concerning patient safety, infection control, and the scope of practice for healthcare professionals. It exposes the patient to significant risks and undermines the integrity of the healthcare system. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough assessment of the situation. This involves gathering all available information, identifying potential risks and benefits, and consulting relevant protocols and guidelines. In situations involving clinical procedures, it is crucial to confirm the clinical indication, assess the patient's condition, and ensure that the proposed intervention is appropriate and necessary. Effective communication with the requesting clinician and other team members is paramount. If any doubt or ambiguity exists, seeking clarification or escalating the concern to a more senior clinician is the responsible course of action. This iterative process of assessment, consultation, and action ensures that patient care is delivered safely and effectively in accordance with regulatory and ethical standards.